Virtual fracture clinic. Radial head or neck fracture.
Hi, I'm Tom Tressiter, an orthopaedic consultant at the Royal Melbourne Hospital. At the Royal Melbourne Hospital, the Virtual Fracture Clinic is run by specialist orthopaedic consultants and advanced practice physiotherapists. In many cases, we can review your injury and provide care without you needing to come back into the hospital. This video will give you the information you need to manage your recovery. The radial head and neck are at the elbow end of the radius bone in the forearm. Fractures in this area are common and often occur from an injury like falling on an outstretched hand or a car accident. You can expect to feel pain and may see swelling, redness, and sometimes bruising. When your elbow is examined, there will likely be a point of maximal tenderness over the fracture site. On an X-ray, we might see a crack or dark line. This is a fracture or break. It is very rare for this type of fracture to need surgery. It will almost always heal on its own given some time and support. If you are able to do this movement,
Tom rotates his hand 180 degrees.
Even though it may be very painful, it's likely that the fracture will heal on its own.
Treatment.
The most common treatment is to wear a sling for a few days and limit loading while the fracture heals. It is important not to bear weight through the injured arm. This means no lifting, carrying, pushing or pulling for 6 weeks. Objects up to 250 grams, like a can of drink or a mobile phone, are okay, as long as it doesn't cause discomfort. Use your pain as a guide to how much you can use the arm in the first weeks of your recovery. It is not harmful to move your arm, though there may be some discomfort. Feeling very sore is a sign that you should rest more. Follow the exercises in the brochure to reduce the risk of complications like stiff fingers. This fracture is expected to heal in 6 weeks. If you're a smoker, this can slow healing time, so we advise that you cut down or quit. You will not need to come back to hospital or have any more X-rays. If after 3 months you still have pain or problems using the arm, contact the Virtual Fracture Clinic or visit your GP.
Can I drive?
You shouldn't drive for 6 weeks until you can grip the steering wheel firmly.
When can I go back to work?
Getting back to work will depend on the job that you do. A desk worker may return in a few days. Someone who has a very physical job may need 6 or more weeks off. Speak to your doctor if you need a medical certificate.
Can I stay active?
You can return to playing sports or the gym after 6 weeks. You should have a near full range of motion, at least 85% of your strength, and little, if any, pain. A physiotherapist can help you with a return to sport exercise program. Start with the exercises in this video.
Care at home.
Hi, I'm Emily and I'm a physiotherapist at the Royal Melbourne Hospital. We're going to talk about how to wear your sling and some exercises to help your recovery. To fit the sling, make sure your elbow goes into the corner of the pocket, then fasten around the neck. Ideally, your fingers should be slightly above the elbow to manage swelling. Elevating the arm can help, especially if the fingers are swollen. It is also advisable to use an ice pack or frozen peas over the area to help with swelling and pain. Wrap your ice pack in a tea towel or cloth. Never place ice in direct contact with your skin. If your pain is not improved with rest and ice, you could try over-the-counter pain relief such as Panadol or Nurofen. If you are still very sore, consider an appointment with your GP to talk about other medications. After 2 or 3 days, start these simple exercises to help your recovery. You should do your exercises 4 times a day or more if comfortable.
Exercise 1. Shoulder pendulum exercises.
Remove the sling and holding a firm surface with your non-injured arm, lean over and gently swing the injured arm in circles.
The model swings her arm in a circle.
Then, front to back.
She swings her arm forward and back.
And side to side.
The bent over model continues to swing her arm side to side.
Repeat this 10 times.
Exercise 2. Finger range of motion.
Bend your fingers down like making a fist, then open the hand out wide. Repeat this 20 times.
The model continues to open and close her fingers. Exercise 3. Elbow flexion and extension.
Bend and straighten the elbow. You may like to use your non-injured arm to assist. Repeat this about 10 times.
The model continues to raise and lower her right arm at the elbow. Exercise 4, forearm rotation.
Keeping the elbow tucked into your side and bent to 90 degrees, rotate your palm over and back to feel a mild stretch.
The model continues to rotate the palm of her right hand.
Repeat this about 10 times. It is normal to take 6 to 12 weeks or more of exercises to regain movement. If you have stiffness or weakness persisting after that time, it may help to see a physiotherapist. You can see your own physio locally or contact the virtual fracture clinic to arrange a physio appointment at the hospital.
It's important that you understand these instructions. You're in charge of your own health. If you have any questions about your recovery, contact your GP or the virtual fracture clinic.
The Royal Melbourne Hospital.